Well, Fran, I know that in the early 90s, a lot of the child sexual abuse prevention work that was going on focused on children. And then when you came along and started thinking about this issue, you had a whole other approach that was, in my mind, very innovative and unique. Could you tell me a little bit more about how that thinking process that went into coming up with this new way of preventing the sexual abuse of children?
Well, certainly back in the 1980s, when I was coming into my own professionally and just really coming into my own as a healer from child sexual abuse myself, I gave a lot of thought to what was the prevailing program around teaching children to protect themselves, teaching children about what safe touch was. And while those kinds of programs made sense to me, I just knew from my own experience that it didn't go nearly far enough to do the kind of prevention that would stop abuse from happening in the first place. It just seemed to me that it put too much responsibility on children to kind of know when dangerous situations were, when they were in dangerous situations. So what I thought about was, what would I really wanted in my own circumstances, and what else I had learned. To so many people have told me over the years that they themselves had been sexually abused as children, and I've spent time talking to people about it. And I realized what an awful lot of us wanted is that we wanted the adults in our lives to have fully taken responsibility for this, to figure out, well, who's at risk, what's at risk, and then to take some action before I, as a child, am in a position of protecting myself. Mm-hmm. And then what I learned also is that there's a whole system of public health out there that we have learned to rely on when it comes to, learning about wearing bicycle safety helmets, for example, or learning how to wash our hands because we spread germs that way. Well, if we applied that same kind of thinking in the public health system to this issue of child sexual abuse, I knew we would have some creative prevention programs that just hadn't been thought of before, hadn't been used before.
Mm-hmm.